Hi, thank you for viewing my poster today. My name is Dr. Rajvir Kahlon. I am currently working in Musgrave Park Hospital, Belfast, as an orthogeriatric specialty doctor on the post-fractures ward. A significant proportion of the patients I see on the ward have a past medical history which includes a diagnosis of dementia. I'm particularly interested in advanced care planning in patients with dementia, and I felt I had a useful opportunity to explore this topic further. My poster focuses on a quality improvement project looking at advanced care planning in patients with moderate to advanced dementia. Dementia is extremely prevalent and only increasing. In 2051, it is projected that 1.7 million people will be living with dementia in the UK. Dementia represents a significant health economic burden for the NHS, with hospital costs having risen by 1.5 billion in 8 years, with 90% of these costs being attributed to emergency hospital admissions. Advanced care planning is a cornerstone of holistic management in patients with dementia. It allows the patient or next of kin an opportunity to state their preferences regarding future medical care. Advanced care plans can also be important in the secondary care setting, as they can help guide physicians in managing patients and, where possible, treating patients in accordance with their preferences. The aims of my quality improvement project were twofold. One, I wanted to identify if patients with moderate to advanced dementia had advanced care plans in place. Two, if an advanced care plan was not in place, I wanted to find out if the patient or next of kin was aware of what an advanced care plan is. The reason I decided to focus on patients with moderate to advanced dementia was because this was the cohort of dementia patients which conferred the most significant health economic costs through emergency admissions. It is also true that by the time a patient has progressed to moderate or advanced dementia, there should have been ample time for an advanced care plan discussion to have taken place. The data for the Quality Improvement Project was collected between the 1st of March and the 31st of May 2023. In this time, 18 patients with moderate to advanced dementia were identified. Dementia severity was classified by using the Clinical Frailty Scale. Once a patient was identified, their capacity was assessed. If the patient was not deemed to have capacity, then questions were asked to the next of kin instead. The two questions asked were: 1. Had an advanced care plan been put in place? 2. If not, were they aware of what an advanced care plan is? So on to the results. No patients were deemed to have capacity, and therefore questions in each case were deferred to the next of kin. Out of the 18 patients who fit the criteria, no advanced care plans had been put in place, and only one next of kin was aware of what an advanced care plan is. In conclusion, whilst the sample size was small, the conclusions drawn from the data were very clear. Patients with dementia continue to have few advanced care plans in place, and there's also a significant lack of understanding regarding what an advanced care plan is. Through improving education around advanced care planning, we may see an increase in the number of advanced care plans being made. It also may be true that a greater number of advanced care plans, particularly in patients with advanced dementia, whom often have a significant degree of coexisting frailty, may lead to more appropriate ceilings of care being put in place in the community, thereby reducing the number of emergency hospital admissions for futile treatments. In response to my findings, as an intervention, I have produced a leaflet providing a synopsis of advanced care planning in relation to medical treatments for patients with dementia. I plan to hand these leaflets out to patients or their next of kins and follow up on these patients in a few months' time to see if this has led to an advanced care plan being put in place. That is the end of my presentation. Thank you for listening.